Hey surgical YouTubers, it's Kelly Slater here, the surgeon not the surfer. I'm a general surgeon in Brisbane, Australia. In this video I'm going to talk to you about pilonidal sinus surgery and specifically endoscopic treatment of a pilonidal sinus using a new technique called EPSiT. Please remember this video is for educational purposes only, and if you're a patient you must talk to your surgeon about your diagnosis and treatment. If you're a doctor, you must hold suitable qualifications to carry out this procedure. So, what's a pilonidal sinus? Literally meaning nest of hairs, a pilonidal sinus is a cavity under the skin that contains hair. It most frequently occurs at the top of the nasal cleft, and even though it's close, it has nothing to do with the anus. It's a really strange human condition, but is far more common than people realise. There's lots of theories as to how they form. The most logical one in my mind is that some people are born with deep pits in the skin between their butt cheeks, similar to the enlarged pores that may lead to blackheads on other parts of the body. Hairs regularly shed off the back and the head and get sucked into these pits due to the friction created in the butt crack. This is why sinuses are more common in people who drive for a living or who live in hot, sweaty climates. There are two phases of pilonidal disease. Some people are not even aware of the first type, as they often have no symptoms. They may come as a painless lump or might occasionally release some fluid. They also may be found in a routine medical exam. The second step in the disease process is a pilonidal abscess. When there is a lot of hair in the cavity, this gives the bacteria a great space to grow in and the sinus will become infected. When bacteria get active, they create pus. The body is pretty amazing though, and the pus can erupt all by itself, immediately releasing the pressure and relieving the pain. This release of pus might happen anywhere on the buttocks and create another sinus. Even though the pain will calm down, the sinus and the hair will still be there. There are lots of treatments that have been described over the years to treat pilonidal disease. Abscesses are usually drained urgently to let the pus out, and in many instances the sinus will recur and will need an operation in a more arranged manner down the track. Draining an abscess results in a big wound that can take weeks to heal and involves leaking and lots of messy dressings. Arranged treatments for pilonidal sinus revolve around flattening out the butt crack and removing the pits. All of these procedures are painful and they can require a lot of time off work. They have a high risk of infection and they don't always fix the problem. The EPSiT procedure is relatively new and it involves putting a keyhole camera into the cavity and clearing out all the hair. This video will demonstrate how I do this. Because it's a new procedure, it's not entirely clear how good the long-term results will be. But because it's relatively painless and only requires one day off work or school, most patients would be happy to have this done over and over again if the sinus comes back. Especially given they have usually been through many painful treatments for their pilonidal disease in the past. This operation is done under a general anaesthetic and the patient is placed in the prone or face down position. The buttocks and back are shaved and we perform a first round of laser hair removal, as I believe this decreases the risk of recurrence. Permanent hair removal requires many more treatments to achieve hair reduction. We do this as an outpatient treatment for many weeks after the initial procedure. This patient has a particularly severe sinus with many open pits. He had never presented with an acute abscess as the pus was able to escape freely through the pits. The buttocks are taped so they're held widely apart. This is the scope we use. It's an anal fistula scope made by Storz and it comes with a grasper and brushes to use in the working channel. The patient is prepped and draped and the scope is assembled and attached to a light source. The first thing to do is to dilate one of the pits with an artery forceps and the superficial hairs are removed. There is an extraordinary amount of hair in this sinus. scope is then introduced and glycine irrigation is used to open the cavity, and this facilitates the cautery. If the fluid leaks out of the other sinuses, I cover them with a waterproof dressing to maintain a seal. The entirety of the sinus is explored superiorly and inferiorly. At first there may not be much to see, but as the grasper is introduced into the working channel, lots of hair will come into view. You have to keep going until all the hair is gone, and this can take a while. One operator holds the scope steady while the other goes in and out with the grasper, pulling the hairs one by one. A cautery ball is introduced and the entire sinus is cauterized until the fibrin is gone and the bleeding is stopped. The bubbles produced by the diathermy means that it's burning well. The cavity is now nice and clean. This is the finished result. I use a suction dressing over the wound and keep it in place for a week. The sinuses are usually healed in the second week, and I encourage the patients to be vigilant about their hygiene to prevent recurrence and shower twice a day, paying special attention to washing out any hair that may have fallen between their butt cheeks. I'll continue their hair removal therapy as an outpatient and review them every 6 months. I really hope you've enjoyed this video, and don't forget to check back frequently for new posts. If you like us, don't forget to subscribe.